This is Denise Beery. I am a student at Indiana State University in the LPN to RN BSN program. This is a health education project for community health nursing. I will be discussing the benefits of exercise for older adults. Specifically, the focus of my discussion will be the importance of being mobile by staying physically active for fall risk prevention. At the conclusion of this presentation, the viewer will be able to understand the following learning objectives. Define mobility. Identify 2 risk factors for immobility. Identify 6 health benefits to engaging in exercise programs. List 4 forms of exercise that help to prevent falls and improve health. Identify the number of minutes of weekly exercise recommended by the CDC, and explain 6 safety tips for safely starting an exercise program. Please take a moment to check your knowledge by pausing the video and clicking on the pre-test link below the video. Why is exercise so important to do when you are 65 and older? According to an article by the National Institute of Aging, maintaining mobility and preventing disability are key to living independently as we age. What is mobility? Mobility is the ability to move or walk freely and easily. The CDC describes the importance of having a mobility plan to help stay independent. According to the Physical Activity Guidelines for Americans, staying active and mobile from regular physical activity makes it easier to move around your home, doing your normal activities of daily living, and around your community and neighborhood. Research shows that physical activity can improve physical function in adults of any age. As you get older, you may experience a decrease in upper and lower body strength, which can lead to an increase in risk for falls. The following are fall facts, according to the CDC. 1 out of 5 falls causes a serious injury, such as broken bones or a head injury. Each year, 3 million older people are treated in emergency departments for fall injuries. Over 800,000 patients a year are hospitalized because of a fall injury, most often because of a head injury or hip fracture. Each year, at least 300,000 older people are hospitalized for hip fractures. More than 95% of hip fractures are caused by falling, usually by falling sideways. Falls are the most common cause of traumatic brain injuries. In 2015, the total medical costs for falls totaled more than $50 billion. Medicare and Medicaid shouldered 75% of these costs. Conditions that make it more likely to fall are lower body weakness, difficulty with walking and balance, vision problems, foot pain or poor footwear, home hazards such as loose carpet and poor lighting, medications that can cause sedation and/or affect your balance. These are some ways to prevent falls. Do strength and balance exercises. Have your vision checked once a year. Make your home safer. Clear areas in your home of tripping hazards. Remove the clutter is an example. Make sure your home interior is well lit. Use non-slip mats in bathtub and showers. Have railings on stairways. Install grab bars near the toilet and bathtub, and make items in the cabin easy to reach to reduce the need of using a stepladder. Have your healthcare provider Evaluate your fall risk and medications that may affect your balance. These are some health benefits from exercise: improved balance, improved strength and flexibility, which help to improve mobility, improve relaxation, decrease pain, and decrease likelihood of falls. The CDC and the National Institute for Aging find that these 4 forms of exercise improve health, such as balance, muscle strengthening activity, flexibility, and endurance. Several programs are available to aid you in those 4 forms of exercise. Tai Chi and yoga are 2 examples. The movement taught in Tai Chi addresses balance issues, muscle strength by using bent knee stance, teaching transfer of weight from one leg to another, corrects instability by addressing posture and gait by teaching correct movements of the lower limbs, and then it addresses coordination by teaching slow, smooth movement. Yoga involves slow movement and stances that are combined with relaxation and breathing techniques. Combine this with strength training, it improves balance and flexibility. 2 further examples are muscle strengthening, which should involve all major muscle groups. Examples of such would be lifting weights, using resistance bands, carrying groceries, and climbing stairs. Another would be endurance programs, often referred to as aerobic activity. Examples of these activities would be bicycling, brisk walking, dancing, and swimming. The suggested amount of weekly exercise, according to the CDC, is a recommendation of 150 minutes a week, which can be broken down to 10 to 15-minute intervals 2 or more times a day. These are some safety tips that you should consider before starting any exercise program. First and foremost, before starting any exercise program, check with your healthcare provider to discuss your activity plan. Start slowly and build up your activities over time. Warm up your muscles before you stretch. Pay attention to your surroundings. Make sure there's no clutter or tripping hazards. Wear appropriate fitness clothing and shoes for your activity. Drink water, even if you're not thirsty. Please pause the video at this time and click on the link below to complete the post-test. On this slide, I am providing additional resources that you may utilize. My mobility plan is a plan that you can use to customize your own activity plan to improve your mobility and independence. A guide to how older adults can get started to exercise has a link to physical activity guidelines for Americans. Get Fit for Life is a booklet that will help you learn about exercise and physical activity as you age to help you get started. And Move Your Way is another utility that you can use to build your activity plan. These last few slides are the sites in which the material for this discussion were referenced.